Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, and Ohio University Lancaster.
Welcome to Fairfield Today. I'm Lisa Hooker. In honor of Fairfield Medical Center's upcoming centennial anniversary, we are broadcasting today from the Medical Center's historical archive room. It is full of newspaper articles, physical items, medical equipment, all kinds of things, and it will soon be opening to the public, and we will let you know about that. Fairfield Medical Center has already had, in honor of its centennial gala, as well as the rock party that was held at the fairgrounds. Going forward, they are also planning different activities with the community to carry us into 2016. So make sure you look forward to the news about that. We're going to open today's show with an interview with Caroline Rockwood. She was Fairfield Medical Center's very first volunteer.
Tell us about the program that you were intimately involved with Maxine Rutherford, who sadly we just lost recently, but it involved the Red Cross and assistance to the hospital itself.
Well, indeed, Maxine, it is a loss for everybody, but she has recently died, and she was the first floor nurse. When I went, let's see, how did I work that? I knew I had friends in Columbus who were giving volunteer service to the hospital in Columbus. And it was a very difficult time during the war, and those were the dates, to have a doctor or to get a nurse or to be sick. And they needed all the help they could get because the doctors, nurses, people who were in the medical profession had many of them, a great many of them, gone to war, Army, Navy, any number of things, and gotten jobs, perhaps, someplace other than even nursing or being a doctor, that helped with the war effort. Everybody helped doing something during the period of the war. They were either knitting things for the boys who were seeing the service, maybe entertaining them when their trains or when they went through the town. Everybody was there with sandwiches and a cool drink on a hot day, lemonade, of course, or something cool to drink. And mothers and children, everybody helped. And I thought, well, maybe the hospital needs help too. And so I went to a group who were helping up at Children's Hospital in Columbus and asked about it, and they said, well, you have to go to the Red Cross because they train people to be nurses' aides in the hospital. So I came home and I went to the Red Cross, and I discovered that Mrs. William Fisher, Mamie Fisher, was the head of volunteers for the, I don't know whether it was Fairfield County or just Lancaster, anyway, for the Lancaster hospital. And I tried to get enough people, which would have been any place from maybe 8 to 12 for a class. And she commandeered a nurse. And in those days, there was a nursing house that stood beside the hospital. But we got the class together and we went over to the nurse's house where Aileen Manberg taught us the things that we could do. And of course, we did not ever give any medication out or treat a patient except to bathe, to get up, to read to write letters for, to smile with, be happy, and make them comfortable. It was a very wonderful thing, I thought, to be able to do that and help people feel better when they were in the hospital, and they always were grateful to us. And we had a meeting regularly, and sometimes we added to the number of people who were doing it. I'm sure we had, the hospital had to schedule us. They had to talk with the nurses' aides. We carried trays. We showed visitors where they could go to be comfortable if they were waiting to hear a report from a patient. And I was living at Mother's house right across the street with Dodie, because Rocky was at sea in the Pacific.
Tell us what it was like throughout the community. It sounds like people wanted to help no matter what, what they were involved with. But during the war, it was a pretty unified effort, and there was, visible patriotism. And what was the Lancaster community like at that time?
Very together, with many things planned. We would all go to parties that were given to entertain the soldiers. Some who came on a train, or, there was what's the fort up in Columbus?
Fort Hayes.
Hayes. And then, of course, there were the air. But people were knitting socks. If you rode on the bus, of course, we didn't have gasoline, so if we went any place, we had to go by bus, pretty much. And there was some kind of group that would be happy to entertain. If you'd have a party, we had dances for the service people. Dinners. If there was sometimes you just almost pick somebody up. It was a very generous, open arm feeling among people, because everybody knew. And in those days, fewer women worked. They worked. I don't mean they didn't work, but they didn't have a paid job.
Sure.
And so I'm sure many of them were able to pick up where a man had gone in the service. But by and large, the mothers stayed at home with their children, and the fathers made a living for all of them. But I'm in my 90s, almost 95, and that was a long, long time ago. And of course, everybody had gone to secretarial school, if you could get in. The Balthaser secretarial school. So you knew how to write a letter, because your fathers said, if you don't find somebody, you're going to have to go to work.
Exactly.
And so you thought, well, you could be a secretary, maybe.
What about, you have recollections or thoughts about the hospital early on?
It was small, but medicine was a very different situation. I mean, we had a family doctor, and anybody in the family who got sick saw Dr. Smith. He came to the house. But occasionally you would go to the office and see him if you had an earache or something. The hospital, it seemed a faraway place. And you hoped you never would have to go there. And now people just pile in. That's a big, big difference.
Yeah. And there's more of an emphasis on wellness now than ever before, preventative medicine. And
wellness in my day was cod liver oil, brush your teeth, do it well, and rinse your mouth, and take care of things at home. You had iodine and new skin. And so the hospital, of course we heard the emergency squad, but much less frequently, and we thought that was the end of the world for somebody.
Telling us a little bit more
after we
about...
were supposed to be graduated, and Aileen Mamberg was finished with us, and we were to go into the hospital. Well, that was a big moment. And I was assigned to the first floor where Maxine Rutherford was the head nurse. And the nurses were to put up a schedule and give your name, and you would review with the head nurse what you were to do that day with that patient. And you would be told, what their problem was to a degree, just a very superficial evaluation of what it was and how you had to turn them, or how you had to be careful. Always you were cautioned to go quietly, have a happy smile on your face, talk gently, and rub a back if they want it. And of course we gave baths, we carried trays, we had been taught how to make a hospital bed, which I already knew, my mother had shown me. And we greeted families when they came and left. We left. If we were there, we left them to the families. We didn't ever give pills or do anything as I might have done at home for a child, put a Band-Aid on or something. We didn't ever do anything medical, but anything for comfort. Write a letter, make a telephone call when you were free, do anything that would make a patient feel happy and content. The nurses had more than they could take care of, certainly in an emergency. And the Red Cross has done a great deal. These people, there are many, many volunteers, but as far as any recollection I have, and I think it must have been true up at Children's Hospital, because I had a lot of friends who volunteered at Children's Hospital in Columbus. And that's how the Twigs got formed.
It moved into Twigs?
Well, I don't know about the dates or exactly how it coincides, but I do know that Twig 1, which I was part of, was formed after that. And then later on, I volunteered up at Children's Hospital, and I was in Twig 3. And I think it's a wonderful, wonderful thing.
Welcome back to Fairfield Today. I'm Lisa Hooker. Our next guest is Dr. Krishna Manova. He is a vascular surgeon with Fairfield Healthcare Professionals Vascular Surgery. Doctor, thank you for being with me today.
Thank you, Lisa.
I understand that you have been with the medical center for a while. Can you tell me what it is you do as a vascular surgeon to give our audience some kind of background?
Sure. I've been here about 7 years almost now. I am a board-certified vascular surgeon, which basically means I operate or repair blood vessels all over the body, including veins, arteries, aneurysms. So it ranges from a very complex aneurysm repair all the way to a simple varicose vein procedure.
Well, that sounds like it would have to do with maybe the circulatory system when you talk about the vascular system. Am I right in that?
Exactly. So all the peripheral arteries and veins, so that means everything, all the plumbing except for the heart.
Okay, great. Well, as part of our show today, we have some exciting news that Dr. Manova has been involved with. It's a very interesting accomplishment I understand you had a major role in. The viewers may or may not be aware that Fairfield Medical Center does have a cardiovascular clinical research program, and it participates in nationwide studies. Can you tell us a little bit about the research program before we get to this specific accomplishment?
Yeah, sure. I'd love to. So the research program here has been just an exciting and phenomenal success that we've been able to develop over the last few years. When I first came here 7 years ago, it was sort of my goal personally to help develop a very strong and reputable vascular program. And I think we are at a good stage right now where we're accomplishing that. So one of the components of a very good vascular program is a strong research program to stay relevant nationally, to make sure we're on the cutting edge of all the latest advances. Vascular surgery is a very evolving field. There's been a lot of technological advances over the last several years, 5 to 10 years, and it's difficult sometimes to stay current. And by participating in research, it allows you to stay current, and then secondarily, which is the biggest benefit, allows you to offer the most advanced procedures to patients locally. So that's the drive for pushing for the research program. And Lisa Stevens, we hired as a research coordinator. She's one of our long-term nurses at Fairfield Medical Center, and she's been just a fantastic asset and a go-getter to really help me and the other physicians involved in the research program develop a lot of these studies that we're doing.
Well, the one we're here to talk about today is called Lucy, and I understand that Fairfield Medical Center, to its great credit, was the first hospital in the nation to enroll and treat a patient in this Lucy study. Tell us a little bit about it.
So this is a really exciting study. We fix abdominal aortic aneurysms, which are an aortic aneurysm is an enlargement or swelling of the aorta, the main blood vessel in the body. And it's a common condition that, if untreated, it poses a serious risk of rupture of the aneurysm and death if it's not treated. Studies so far over the last several years have been predominantly focused on men. Men more commonly get aneurysms, and a lot of the research has been focused on them because of that. We have been fixing these aneurysms using minimally invasive techniques called endovascular techniques with stents, where we fix the aneurysm internally and reline it and seal it off from the circulation. The sort of old-fashioned way we'd fix these is by doing an open major surgery and repairing the aneurysm. So a lot of the research, like I said, on men with these stents to treat aneurysms has really sort of not captured women and some of the differences in anatomy with women. And sometimes women are excluded from studies and research studies because of their anatomy. So the Lucy study, which is named after Lucille Ball, who actually died from an aneurysm.
I did not know that.
Yeah, so she's one of the most prominent figures in entertainment, in television, and to have this sort of disease, it was very fitting that we're evaluating women with this, and she had this. So women's anatomy specifically, they have smaller blood vessels than men. They're smaller framed and therefore have smaller arteries than men. And sometimes the stents that we use to fix the aneurysms don't fit through the smaller arteries, and therefore you can't often repair the aneurysms with some of the larger stents. The Lucy study is looking at a device called the trivascular ovation stent. It's a stent that's used commonly for aortic aneurysm repair, but it has such a low profile and it's so small when you deliver it, it can track through much smaller arteries and blood vessels to get through to the aneurysm. And a lot more women who have smaller blood vessels may qualify for repair because of the low profile of the device.
Is that what the study was about? And are we the only participant in the study? Or are there other hospitals and medical centers and doctors and patients involved with it too?
So I think there's approximately 40 or a little over 40 other sites around the country that were selected to participate in the study. We were one of the sites given our experience and success rate, and also our experience in general treating aortic aneurysms with endovascular minimally invasive techniques. So we were selected. And
who did the selecting?
I think this was a industry or the company-driven selection process. So that's how we got selected. We have, because of Lisa and her efforts and our efforts, the timing worked out that we were able to enroll the very first patient nationally in the study. And she had a successful outcome, a great procedure, came in for the procedure. The next day was sent home. I saw her back in follow-up already. She's doing great. Her aneurysm is sealed off. And since then, we've done two more cases. So we are one of the leading centers in the country enrolling patients in this study. And
I guess when I think of research studies, and I'm guessing maybe some of our viewers as well, we think of bigger health systems. And obviously we are incorrect in that assessment and in our views. So is this unusual for a medical center such the size of Fairfield Medical Center? Certainly it's a feather in everyone's cap here. But is it unusual for a site of this size to be included and have such great results in such a study like this?
That's a very good question. So yes, we are very proud of what we are accomplishing right now with this. You typically do associate research studies and clinical trials with big health systems, university systems, academic centers. So there are a couple different types of research studies. One are clinical studies and trials, and there are other bench basic science type research studies. And although we haven't gotten into the basic science stuff, which requires a lot more academic support, we can excel in clinical studies where we have large volumes of patients and we have a very successful system in place to do these procedures. And the key was having a research coordinator to help us as physicians participate in the studies with all the requirements that are needed, the data collecting and the patient interviews and so forth. So it is a very important accomplishment for Fairfield Medical Center and where we are today. And so we're very proud of that.
Are you still enrolling patients? Is there still room in the Lucy study for those that have those types of aneurysms?
Yes, we are actually. The Lucy study, although we are studying women specifically, the study actually enrolls men and women, and we want to be able to draw some comparisons between the two groups.
What are some symptoms of this particular type of aneurysm that is in the study? How would someone know if they had it, or would they?
That's the thing about aneurysms, aortic aneurysms. Most of the time they're silent and until they rupture. And once they rupture, your odds of survival are very low. So to fix these by catching them through a screening test or a simple exam by your physician is the best way to catch them and repair them when they reach a certain size. And so that's generally what we try to accomplish.
Is this the first time Fairfield Medical Center has participated in a study such as this, or are there others that you would be aware of that you could share?
So we have several studies going on right now, cardiovascular studies in particular. We have a thoracic aneurysm study where for aneurysms of the thoracic aorta in the chest. And we were actually, fortunately, the first center in the country to enroll a patient in that study as well. So now we have two of them. We also have a couple other studies. One are for pulmonary embolisms, blood clots to the lungs. We are doing a study at our institution only to evaluate the success of interventional treatments for these blood clots, which is a relatively newer modality to treat these clots. We have another study evaluating chronic blood clots in the leg, and that's also a newer study. That's a national study that we're in. And we're also doing a study on the use of lidocaine anesthetic when we're doing heart catheterization procedures. So we have a few other studies going on, so we're pretty busy.
You are very busy, and more than a few, and how rightfully proud Fairfield Medical Center and Dr. Manova and all his colleagues here should be of what they're doing. And equally importantly, our community should be proud of what Fairfield Medical Center, Dr. Manova and his colleagues are doing in these studies and their day-to-day work. Dr. Manova, thank you. We appreciate your time today. Keep up all the good work. It's exciting to hear about.
Thank you, Lisa. My pleasure.
We'll be right back in a few minutes with some events and activities you need to know about. As we finish up Fairfield today at Fairfield Medical Center, Latricia Johnston, who is the Centennial Project Director, joins me now in this archive room. Latricia, there are all kinds of things in here, including a great big 100 behind you. But this particular case is one you wanted to talk about. Can you tell me what's in it?
Sure. Kind of one of my favorites. This is our firsts. A lot of what we have here we've deemed as our first people that we know have come to our hospital. So our very top case, I don't know if he'll be able to get in and get a close-up of it or not, but this is actually the Armentrouts. Oni and Evelyn Armentrout came through town. I don't want to share the whole story because you need to be watching your monitor that's coming out because we have a very detailed story about that. But they were our very first patients. They have one living daughter. And she was here with us recently for our gala that we just had in October. And so she brought some of her items, the actual very first medical records here of our patients at the hospital. We've kept them in our vault, and those are actually in here as well. So we just have a lot of nice things. We know who our very first in vitro baby was born here, delivered by Dr. Detty. So they have given us some things on loan, infant items, and then we know our very first triplets. Some of the people listening might have known the Rocky's Confectionery store that was very common around town, and that was that family. So we just have a lot of different things around in this area that I strongly encourage, if you're listening out there, please, when we open it up, come in and visit us. We're actually going to be manning this by volunteers. So if you're listening and you're interested in volunteering for the hospital, please contact us because we have both day and evening opportunities available for anyone that would be willing to come in and have our archive room open. It's just going to be a good thing for our patients and families while they're waiting on loved ones having tests done right around the corner at the surgery area. This is just another opportunity for them to come and get those things off their mind and explore our history. We have an amazing story. We're taking a whole year to share that. I've said that many times. When you have 100 years to celebrate, it takes a whole year to get that whole story.
At least. And I think as people come through here, as they are visiting the medical center for whatever reason, as you look around, I think what they can't help but be struck by is how far we've come.
Absolutely. I've just been reading. I've been very fortunate to be able to have the history in my office, and we have come an extremely long way. If you learn about how cesareans used to be done and how they're done today, I'm really happy I'm in this generation today. We just have a lot with our new surgery tower and everything. It's just we have a lot to be proud of here.
Well, that is certainly the case. Now, there are, as I had said earlier on the show, there will be some more events and activities to celebrate the centennial upcoming in 2016. Do you want to give us a little taste of what the folks can anticipate next year?
Sure. Just a couple of items in March. The Fairfield County Library is going to be partnering with us, and they're going to be doing a presentation for our children about going to the hospital, going to see your doctor, just to make that an easier step for our children.
Not as scary.
That's right. The Georgian is going to be having a historical display of some of actually our items that we'll have on loan for them in the summer, collaborating with the Decorative Arts Center. I believe they're going to have sort of like an attire display that's going on, and we're going to have a role in that as well. So the list goes on. Just met with the Lancaster Parks and Recreation. I'm very excited. In the summer, we are going to have a butterfly exhibit here. So there'll be, the Centennial 100th will be weaved in there. I don't want to tell everything with that, but that's going to be a very exciting event.
And ongoing right now at the Ohio Glass Museum, the picture of health, the importance of glass in the medical field and our daily lives, that continues through August 31st of next year at the Glass Museum, which is downtown. And a little closer in time, on November 26th, the Turkey Day 5K run. And who doesn't need that after Thanksgiving? Now, I don't run 5Ks. However, but for those who do, it will be on the 26th at 8:30. And if they need more information, they can call 689-6822. We've had a great day today on Fairfield Today. Latricia, thank you for joining us. Thank you for your hard work on the interview with Caroline Rockwood earlier, and updating us on what's happening here as the centennial continues.
Thank you.
Thank you for joining us once again for Fairfield Today. We'll see you next time.
Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, and Ohio University Lancaster.